Good morning, everybody. Today we have another lecture on community dentistry that is health-related quality of life. I'm Dr. Fauzia, who's going to give you the lecture on this. What do you understand by quality of life? Is it quality of environment, financial well-being, belonging, sense of belonging, personal safety? Quality of life, the degree to which an individual is healthy, comfortable, and able to participate and enjoy in life events. WHO states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and affinity. The term quality of life is inherently ambiguous, as it can refer both to the experience an individual has in his or her own life and to the living condition in which individuals find themselves. Hence, quality of life is highly subjective. And what do we mean by quality of life? Whereas one person may define quality of life according to wealth and satisfaction with life, another person may define it in terms of capabilities. Having the ability to live a good life in terms of emotional and physical well-being. A disabled person may report a high quality of life, whereas a healthy person who recently lost a job may report a low quality of life. Within the arena of health care, quality of life is viewed as multi-dimensional, encompassing emotional, physical, materials, and social well-being. And what is health-related quality of life? Example like life expectancy and causes of death. It has been traditionally used as key indicators of population health. While these indicators provide critical information about the health status of population, they do not offer any information about the quality of the physical, mental, and social domains of life. When quality of life is considered as the context of health and disease, it is commonly referred to as health-related quality of life, to differentiate it from other aspects of quality of life. Since health is a multidimensional concept, quality of life, health-related quality of life is also multidimensional and incorporate domains related to physical, mental, and emotional and social functioning. Health-related quality of life goes beyond the direct measures of health and focuses on the quality of life consequences of health status. Another related concept to health-related quality of life is well-being. Measures of well-being typically assess the positive aspect of a person's life, such as positive emotions and life satisfaction. These are a few things that we consider as what is important in a person's life. What is oral health-related quality of life? Oral health-related quality of life is a part of health-related quality of life that focuses on oral health and orofacial concerns. It describes the way in which oral health affects a person's ability to function, psychological effect, social factors, and pain or discomfort. This is stated by Engelbert M. and Bagramin, RA 2002. This is example of what Engelhardt and Bergman mentioned. The functions like chewing, speech, swallowing, it will affect, if you can't do any of this, it will affect your quality of life. Pain, discomfort, either acute or chronic. Another aspect is the psychological aspect like appearance, self-esteem, and social aspects like communication, interaction, and intimacy. Again, what is oral health related quality of life? It is a multi-dimensional construct that reflects, among other things, people's comfort when eating, sleeping, engaging in social interaction, their self-esteem, and their satisfaction with respect to their oral health. Okay. The impact of oral disease and disorders on aspects of everyday life that a patient or person values that are of sufficient magnitude in terms of frequency, severity, or duration to affect their experience and perception of their life overall. This is how does status affect quality of life. All right. Self-reports specifically pertaining to oral health, capturing both the pain, functional, social, and psychological impacts of oral disease by Giff and Redford, 1992, the ultimate outcome measures of the oral health care systems. Okay. Oral health quality of life measures. These measures, which were initially designed as social dental indicators or subjective oral health indicators, are now more usually referred to as measures of oral health related quality of life, based on the assumption that the functional and psychosocial impacts they document must, of necessity, affect the quality of life. Quantifying oral health. A clinical measures of oral health, perceptions of general and oral well-being, and reported physical, social, and psychological functionings are independent but correlated components of overall oral health related quality of life. The domains of oral health related quality of life measures: 1. Opportunity or resilience. 2. Health perception. 3. Functional states. 4. Impairments, diseases. And 5. Duration of life. It addresses the trade-off between how long and how well people live. The health-related quality of life approach has provided greater opportunity for investigation of the interrelations among oral health, and related outcomes. The inclusion of patient-driven measures such as perceptions of and functional status is critical. Benefits. An oral health related quality of life approach benefits: 1. Clinical practitioners in selecting treatments and monitoring patient outcomes. 2. Researchers in identifying determinants of health, tracking level of health risk factors, and determining use of services in populations. And 3. The policymakers in establishing program and institutional priorities, policies, and funding decisions. And you can find it the uses of health-related quality of life measures. There is 1. Screening and monitoring for psychosocial problems in individual patient care, population surveys or perceived health problems, medical audits, outcome measures in health services or evaluations research, clinical trials, and cost-utility analysis. And uses of quality of life measures in clinical practice. You can identify and prioritizing problems. You can facilitating communications. It can screening for hidden problems. It can facilitating shared clinical decision making and monitoring changes or responses to treatment. Properties needed by measures used in clinical practice. 1. The quality measures of life, oral health related quality of life measures must be valid, appropriate and acceptable, reliable, responsive to changes, and interpretable. How? The problem is how do we measure health-related quality of life? Okay, there are categories of health-related quality of life measures by SLIT 2002. One is social indicators used to assess the effect of oral conditions at the community level. Example is days of restricted activity, work loss, or school absence. 2 is global self-rating of oral health-related quality of life, single item ratings or general quality about oral health. And 3 is multiple item questionnaires, most widely used. Overview of health-related quality of life measures. You have generic and specific. In under generic, you have general health, and under specific, you have oral health-related quality of life measures. Okay. Overview of oral health quality of life measures. You have specific, general. Okay. Under specific, you have disease or condition like oral cancer, which may not lead to dentofacial abnormalities. You have oral health dimension, example oral dental anxiety, and you have specific populations, example children. And under general, you have overall oral health of a patient. These are the general oral health related quality of life measures, which as we are saying that they are not only one item but they have to have several items to measure the oral health related quality of life. Example, the general oral health assessment index, that is the GOHI measurements. Alright, they need at least 12 items. But usually they use 11 items. The domains usually chewing, eating, speech, social context, appearance, pain, worry, and self-consciousness. Second one is Oral Health Impact Profile, OHIP, by Slit and Spencer, 1994. There are actually 14 to 49 items in it. And the domains is usually function, pain, physical disability, psychological disability, and handicap. The third one is oral health related quality of life by McGrath and Betty 2001. They, they contain 16 items. The domains will be eating, appearance, speech, health, relax, sleep, social, romance, spa or laugh, confidence, carefree, mood, work, finance, personality, comfort, and breath. So, another measures are oral impacts on daily performance by Presin et al. 1997. Consists of 9 items. The domains will be performance in eating, speaking, oral hygiene, sleeping, appearance, and emotions, or more than that. Okay. Ch- Another measures is Child Oral Health Quality of Life Questionnaire by Djokovic and Locker 2002. It consists of 36 items, and the domains will be oral symptoms, functional limitations, emotional well-being, and social well-being. Another one, we can see the functional assessment cancer therapy head and neck module, okay, by Silla and List 1996, which contain 39 items, and the domains will be physical, social, emotional, functional well-being, and head and neck concerns. About the child oral impacts on daily living by Gurunpung Taskos and Shehem 2004, it contains only about 8 items, and the domain will be functional, psychological, and social limitations. And the last one is Autognetic Quality of Life Questionnaire by Cunningham et al. 2000. It contains of 22 items, and the domains will be social aspects, facial aesthetics, oral function, awareness of dentofacial aesthetics. Okay. Applications of the measures. It needs in dental public health, oral and maxillofacial surgery, oral medicine, periodontology, oral rehabilitation, aesthetic dentistry, orthodontics, pediatric dentistry. Okay. And limitation of health-related quality of life measures. They have limitation in standardized measures versus individually assigned values to quality of life, length of multiple item questionnaires, and there is interpretation of health-related quality of life scores. Final thoughts. With regards to assessing health outcome in health promotion interventions, can we use health-related quality of life or oral health-related quality of life measures? Which one would be more appropriate? In what context do we use them? Right? And in conclusions, no single instrument can be regarded as a standard, comprehensive instrument for measurement of oral health-related quality of life. There will always be a need for both generic and more diseases or condition-specific instruments. Characteristics of a good instrument may differ for group comparison, for public health purposes, compared to measurement of within subject changes. Okay, as we said before, in surveys or researchers, they use multiple use of multiple domain that is used in their researches. Okay, I hope you understand my lectures. If anybody needs any clarification, you can contact me in my room. Thank you very much.